Nobody told me that becoming a surgeon was the most difficult part. In truth, surgical residency is and will be the most difficult part, at least in India, at least for the current time. So if you're planning to do MD or MS in India, please do watch this video before making the most important decision of your life. PS disclaimer, this is not a discouraging video, this is just a reality check of what people go through, of I went through. Now the first thing is that it is a thankless job. Nobody is going to thank you for doing your job because it's just your job. You're supposed to do it. Suppose you commit a minor trivial mistake or a big mistake, whatever, sometimes relatives might even beat you up. That's just the reality of it. Now the second thing you need to know is the insane, humongous work hours. Ideally, if suppose a 9 to 5 worker or someone who works even in the business, they might have, 70 to 80 hours work weeks max. But we have 72 hours work days sometimes. That is, suppose you go for duty on one day and you continuously work for 72 hours and then you come back home, after 3-4 days without any sleep. And the thing is, the probability of you making a mistake rises exponentially with every hour passing, and the mistake you're committing is messing up with someone else's life. That's really I remember I was doing a duty, I think it was second day, so sometimes we have 2 days consecutively we are on call, that is 24 hours we are in hospital and we are supposed to attend all the patients that come in the emergency. It was nearing the end of the second day or the third day, I don't remember, but as it was nearing, I was counting the hours and emergency laparotomy came in, and we had to prepare the patient, we had to see the patient properly, and 3-4-5 hours went by, I think, including the OT, pre-ops and the post-op and the shifting the patient. Then another patient came in and it took whole of the next day from preparing everything, MLCs and routine investigations, deciding whether or not to take the patient, faculty seeing the patient, and I went home the next evening, which is mad, and taking rounds, again doing all the work. So it's really hectic and really takes a toll on your mind, your body, your soul, everything. And the third thing is hierarchical toxicity. Now I'm not saying it's there everywhere, but it's definitely there. And toxicity usually comes from the top, that is the hospital directors, medical superintendent gives the toxicity to the HOD to the HOU professors, so on and so forth, and reaches you, the residents. And from the residents it seeps from the third year, the second year, and the first year. The first year is usually the scapegoat of all the toxicity. Now, I'm not saying you should perpetuate this toxicity. Obviously, you can break the chain. I did myself when I don't think a moment where I became toxic for my juniors unnecessarily for the sake of it. Obviously, you can scold them, get work done and stuff, but being toxic just for the sake of it is not right. Now, the fourth thing is there are no holidays. Now, I think it's a human right and a basic human need to have holidays at regular times, but residency doesn't work that way. Patients will always be there, hospital will always run, and that's just how life works. Not sometimes, but usually residency entails that you're supposed to work. You're actually made to sign a contract that you're working for 24/7 by 365 days for 3 years. And you're allowed, I think, 12 or 20 leaves per day. That includes sick leaves, personal leaves for attending family functions and vacations. So just forget if you have, family function to attend, or, friends getting married and stuff. You're bound to miss all of these things. And the worst thing is friends probably won't understand the gravity and the situation, because obviously they're not from the medical background, they don't seem to understand residency, so you're kind of sandwiched between these things. The fifth thing is no or little empathy. No, I'm not saying that everyone is like that, but most of the colleges and managements don't give a flying F about you. As long as in government setting the work is getting done, the patients are getting treated, it's all fine. And in private settings, the seats are being filled and the fees are being paid. That's all they care about. And the last thing, and probably the most important thing, is system inadequacies. So India is a hugely vastly populated nation with a so growing population, thanks to our grandfathers and the generations before them, to produce so many offsprings, and their offsprings producing many offsprings. And so the point is, our land is finite, our resources are finite, and the doctor-patient ratio is really blown to shreds. Not just the doctor-patient ratio, the doctor doctor-nurse ratio. That is what I'm talking about, government hospitals. And when it comes to private hospitals, usually all they think about is cost cutting. Most immediate way of cost cutting they can think of is hiring as minimal staff as possible, hiring no phlebotomists, hiring no minimal nursing staff. So the nursing ratio sometimes in wards is one nurse is to almost 50-60 patients in a single ward, and hiring as minimal as housekeeping, and just for the sake of it. So the onus of all the work comes on the residents. So the residents are supposed to do blood work, supposed to manage indents and manage the medications and make sure they go, make sure patient bring the medication or file them yourself according to however the hospital policy is. Then shifting the patient sometimes is the onus is on the residents, because sometimes in emergency the patients are flooded, the beds are flooded, and just one or two housekeeping staff can't obviously keep up. That's the sad reality of it. So basically you're a bonded labor and you're supposed to do jobs that don't fill your job description. That is down to system inadequacies. That is just not, so the point or the problem is not just doing the job you're not supposed to do. Problem is you're supposed there for training, and the training part is obviously being compromised without a doubt, because every hour wasted in shifting patients or doing blood collections or doing menial clerical jobs that nurses or other technical staff, or even like clearing files of claims, insurance claims and yojnas, these things are not supposed to be done by doctors, but they are made. So every hour is of learning, every hour of rest and recovery, every hour of actual training is being compromised. That is just the sad reality of Indian medical education. Obviously a single video won't make any hell of a difference, but it's just to spread awareness of the reality of what's happening inside crux and crevices of all the hospitals. So that's what I wanted to share in this video. Well, I hope you gained some insight and some value from this video. And as I said before, this is not to discourage anyone from taking up residency or taking up this field, but at least making an informed decision before entering this hellhole, if I can say. And the funny thing is, I have completed my MS recently, and I'm going back to complete MCH again, and starting from not necessarily zero, but yeah, going back to the system. Currently doing my senior residency. It's a bit of a downtime for me, kind of. Yeah, nevertheless, see you around. Ciao.